So I was recently talking to this patient of mine who has recovered already from OCD since a long time. So now he comes up just for the following sessions. He likes to interact. He likes to talk about his life, day-to-day life, stressors, and how to manage his mental health. So as we were talking in the session, we realized that we were reminiscing about our work together and how he came and he was crying and he was completely going through a rough patch in his life. And divorce की नौबत आ गई थी, business was failing, everything was just falling apart. He met me, he saw my videos, he was already going through to a counseling psychologist somewhere, and then he realized that the therapy was not really working for him, the counseling was not really working, so he came to me. And then we were talking about things, and as we were reminiscing, he said that, Ayush sir, when I was going through that counseling session earlier, and that was in a very reputed hospital in Delhi, NCR. He said, मुझे ना ऐसा लगा कि when I saw your videos, I figured out one thing, and that was that लोगों की काउंसलिंग करने का तरीका बहुत बुकिश है. When I go to other therapists, they are very bookish. They just, as if they're like doing step 1, step 2, step 3. Your way of counseling and therapy is very realistic. It's very upfront, and you do not hesitate in telling what's right, what's wrong, where am I failing. You do not sugarcoat things. And I absolutely agree to what he pointed out. I don't realize it consciously all the time, but when he did tell me this, मुझे भी realize हुआ कि हाँ, I do this. I believe that therapy is not sugarcoating things. Therapy is not just saying yes and yes in your opinions and your belief system. Therapy is about a training. Therapy is training. That's it. If your trainer is not good enough, if your trainer is not self-sufficient, if your trainer doesn't have that caliber of pushing you through the limits, तो कोई फायदा नहीं है फिर. If you go to a gym trainer and they are just like, हाँ ठीक है, do not raise your intensity, do not raise your strength, ऐसे ही करते रहो, तो what's the point? वो तो आप खुद ही कर रहे थे. So then he came to me and he said, sir, I want to, be in the therapy with you. He came to me, I remember it was like last to last year, I think. He came and he said, Ayush sir, मुझे आपके साथ therapy करना है. And the first thing I tell my patients, are you really wanting to get better? क्या commitment है तुम्हारे अंदर? And he said, ऐसे तो कभी किसी ने नहीं पूछा सर, commitment, of course मैं आया हूँ तो commitment है. I said, आने का मतलब commitment नहीं होता. Do you really, really have the hunger to get better, to grow out of this OCD, this damn OCD? And he said, I'll do anything. And I said exactly what I tell everyone, कि I will see within 5 weeks whether you're committed or not. He did everything what I said, and the elements which he tried. अच्छा उसको कौन सा OCD था? The OCD he was going through was multiple OCDs थे. At that time it was morality related OCD, cheating related OCD, then God related OCD, harm related OCD, what else? Sexual thoughts. So all of those OCDs were combined. The condition was not really good. It was a very, very rough patch for him. But then we started working together and we realized that धीरे धीरे things started working out, and I started pushing him to the utmost capacity जो भी थी. तो मेरा जो तरीका है, it's usually 3 phases. Okay, first you have to commit to the process. It's a two-way process. I am not the god, I am not something magical. I am a scientist, so you have to commit to the process. You have to come to me, you have to be in the process. तो commitment थी. Second था blind faith, trust. You have to be trusting your therapist, your guide. आप गाइड को ट्रस्ट नहीं कर सकते तो नथिंग विल हैपन इन योर लाइफ, नो चेंज यू विल एक्सपीरियंस इन योर लाइफ. सो कमिटमेंट, ट्रस्ट, do as it is. If I tell you to stand up, you stand up. If I tell you to sit down, you have to sit down. If that kind of commitment you have, yes, I can heal you, yes, I can treat you, yes, I am ready to invest my time, my expertise, my knowledge to heal you. But if you don't have that for yourself, if you're not committed to yourself, if you don't really want to get better, or if you're hopeless and you don't have trust, nothing will happen. Nothing will happen. You have to take the first step, first initiative. So commitment होना चाहिए, trust होना चाहिए, and lastly, you have to follow the steps as they are prescribed to you. That's what these 3 elements if combined. Okay. And one day I was talking to a Japanese client of mine and he said, Ayush sir, there's a thing जो मुझे नहीं पता था. I think he named it Gaido or something, I don't know. He said that there's a concept of this thing in Japanese philosophy where you commit to a process, number 1. Number 2, you just follow the guide, you just blind trust the guide and you follow them. And third is when you express, when you actually come out of the shadows of the guide and you perform experiential learning. तो मुझे भी यही लगता है, मेरे 3 steps यही हैं. First of all, observe, imbibe, उसको absorb भी करना, not just observe, imbibe. Commit करो, imbibe करो, observe करो, and then you do it. Then you perform the thing, the same thing. I'm not going to hand hold you for your life. Therapy is not about you relying on me or you making me the god and all. कुछ नहीं होगा उससे. I don't see myself one up position. मैं गाइड हूँ, मैं कोच हूँ, आप फॉलो करते जाओगे, you will get better. And it's my promise that I will do my best to guide you with all my expertise, all my experience, everything that I have. I'm not going to gate keep anything. एक गाइड का काम ये नहीं होता कि वो अपनी किताबें बंद रखे. उसका मतलब होता है दिल खोल के आपको बताए कि these are the things. You are allowed to do anything, whatever the guide is prescribing you. So do that. And if you really think that you have that kind of commitment in you, the zeal in you, then definitely I'm happy, I'm ready, I'm open to help you out. आओ मिलके काम करते हैं. And of course, if you want a free learning, if you're not really committed right now, you're not ready right now, subscribe the channel. That's the only free resource that you have right now. I have the expertise to treat, and I have to help those who are committed for themselves. See you in the next video. Till then, take care and keep beating your OCD like a pro.